Again. So sorry, I'm representing this talk. Earlier, in earlier talk, screen share didn't work. Instead of watching beautiful slides, you ended up watching me. So sorry about this. So now we got the slides on the screen. So I will be presenting it again. So we are covering male fertility workup as a part of IVF series. We are on step 12. This week we will complete the male factors, then move to the cycle planning with the next week. So this talk is on male fertility investigations. So as we discussed earlier, there are three different categories of problems which can cause male factor infertility. So first category is where the problem affects directly production of the sperm by the testis. That's called testicular. So the category of problems which affects pituitary gland's function of producing FSH and LH that we call pre-testicular. And the third category of the problems happens after the production of the sperm and the level of delivery of the sperm in ejaculate. Inventively, we call it post-testicular. So accordingly, the causes of infertility in this category can be different. So in order to establish the cause of infertility, in all men with a history of infertility, we should do three basic investigations. First, we need to take a history. Second, we need to do semen analysis. Third, we need to check for male hormones such as FSH, LH, testosterone, and prolactin. These three investigations give us a pretty good idea what could be the cause of the problem and what category could be the causing the problem. So, and then once we know that, then we can ask more directed history, more directed questions when in history taking and do more directed investigation. Now let us go by category. So first, pre-testicular problems, which is in the level of pituitary function, which means pituitary is not producing FSH and LH hormone properly. So that is usually caused by use of testosterone or anabolic steroids by patient, which is often used for bodybuilding in various sports activities. Then second, chronic severe stress and pituitary adenoma and genetic condition called Kalman syndrome. So after taking history and doing initial investigation, we should do more directed investigation. For example, if we suspect the patient may have Kalman syndrome, we should do genetic tests for that. So the next level of the problem is in the level of testicular. Here, the factors that affect testis directly can cause this type of infertility. So these factors could be genetic, treatment for cancer like radiotherapy, chemotherapy, certain childhood diseases, some reproductive health problems, environmental and lifestyle factors. And these causes directly impact the testicular tissue, testicular tubules, which is producing the sperm. So in order to establish these causes, in addition to the baseline investigation, we should do testicular examination and testicular ultrasound scan. So in these investigations, we check the volume of the testis using, for example, orchidometer, and the consistency of the testis. Because the volume of the testis is mainly made up by these tubules, which produce sperm. If the volume of the test is small, that is a good indication that sperm production is not taking place properly. So so an ultrasound can also give this information. In addition, ultrasound can tell us if there is any other testicular structural pathology. So, and also there are two conditions which can cause severe male factor infertility due to testicular failure, which are Klinefelter syndrome or Y chromosome microdeletion. These conditions can be established by doing chromosome testing and specific genetic tests for those genes. So next level is a post-testicular. In this category of problems, sperm production is normal and FSH and LH is normal, but the sperm, for some reason, is not being delivered from the testis to the ejaculate. So that's also called obstructive problems. So that's usually linked to genetic condition called congenital absence of vas deferens. That's directly linked to cystic fibrosis, and obstruction of the vas deferens, which is linked to a previous history of vasectomy or infections, and problems with the sexual intercourse and retrograde ejaculation. In addition to these two category of investigation, we should do STI tests for gonorrhea, chlamydia, which may indicate if the patient has any obstruction due to infection. We need to check do genetic testing for cystic fibrosis. So, and also ultrasound scan or examination of the testis can tell if there is absence of vas deferens. So, in addition to that, as a part of routine investigation for any patient undergoing fertility treatment, we check for HIV, hepatitis B, hepatitis C, and syphilis. On this slide, you can see that there are three different categories of problems that can cause male factor infertility, and there are individual number of causes of male factor infertility. So it's very important to establish exact cause of male factor infertility so that appropriate individualized treatment can be formulated for the patient and the couple. So in future episodes, we will be discussing those treatment options. Thanks for your time, and I wish you a great weekend. I'll catch you next time. Thank you.